Urinary tract infection is one of the commonest problems. Every woman will get at least one episode of urinary tract infection in her lifetime. Normally, the urinary tract is highly prone to get invaded by the bacteria, and this commonly comes from the motion passage. The bacteria in the colon is the commonest source of a urinary tract infection. Men are not expected to get urinary tract infection for anatomical reasons, whereas women are likely to get repeated urinary tract infection if they are not going to maintain a good hygiene. The infection can enter into the urinary bladder and produce an infection that is generally called as a lower urinary tract infection. This is relatively harmless. This can easily be identified. A routine normal medications as an outpatient can cure this urinary tract infection. On the other hand, if the infection reaches the kidney, then it becomes life-threatening sometimes, especially in a diabetic individual. Infections in the kidney can be catastrophic. Patient will have high swinging fever, pain in the back where the kidneys are located. They may have pain while passing urine, and the infection can spread into the bloodstream and it can produce a life-threatening complication. Patient may even need to be admitted in the hospital. Urinary tract infection has to be avoided. The basic mechanisms how you can avoid urinary tract infections are to take plenty of fluids, not to store the urine in the bladder for a longer time. It is a common practice for all of us not to use a public toilet with the fear that we might get urinary tract infection, but unfortunately, holding the urine in the bladder is more commonly responsible for a urinary tract infection, and infection never comes because you use a common toilet. Whenever we void urine, we are expected to clean our genitals with good amount of water, and we shall avoid constipation. If you do that, a urinary tract infection can definitely be prevented. If anybody has pain while passing urine, sometimes they may have blood in the urine, increased frequency of urination, and fever, abdominal pain are the commonest signs of urinary tract infection. If you get into a problem, you shall go and see your doctor and take an appropriate medication. Any infection in a male and infection in a child definitely has to be investigated, because these two people are not supposed to get urinary tract infection. If they get urinary tract infection, there is something which is making them to get UTI, and what is that predisposing factor has to be identified and it has to be managed. Don't think that urinary tract infection is a simple disease. Most of them, yes, it is simple, but sometimes it can be complicated. So see your doctor if you have any symptoms suggest you have a urinary tract infection.